Welcome back to MMHC. Eddie, what gives you anxiety?
Everything. No, but seriously, on a more serious note, probably everything. I have nothing better to.
Nothing to add on that
No,
one,
no,
huh?
no. Okay, so like whenever I don't know the answer to something, or like if I'm waiting for like a loop to be closed, you know what really sucks if someone like texts you or like you get an email at work that's like, "Can we talk?" Like,
Oh,
no,
yeah.
I don't want to talk to you now. Or, no,
Yeah.
no, I'll tell you about it later. Like, no, I need to know right now. Like, why would you
Yeah.
do that to me?
If people do that to me at work, they're like, hey, can we talk later? I'll always, 100% of the times, like,
Yeah,
what's it about? Like, tell me
yeah,
so I don't worry.
yeah. Because if not, I'm going to make up 1,000 things. And then by the time you tell me, it's not going to be any of them. And then I just wasted a lot of time and brain energy.
Exactly. Yeah. Just,
Yeah,
it's nice to know what you're going to face, right?
yeah, yeah.
So
Well, speaking of
today,
anxiety,
yeah,
take it away. We're here.
we are talking about anxiety. This is a bread and butter mental health topic. Because, last week we did our episode on music, which was a lot of fun. It was a little avant garde, a little abstract, if you will. So now we're getting back to the basics here because
Hmm.
we did an episode on anxiety in the past, but it was over 4 whole years ago. So it's time to
Yeah.
come back and talk about it again.
That shit was episode like 2.
Yeah, Attack
Like
of the Anxieties.
super long ago. Again, if you've been here the whole time, my microphone sucked. I didn't even have a desk. I was just recording on like my computer with this little like lap desk, and I would just sit in my bed and do it that way. So we've come a long way. We're hoping we can bring back some good information for you all about anxiety, and we can just share some information, and maybe you'll learn something new today. Or maybe we'll just reinforce stuff that you already knew, and that's good too.
Yeah. Because repetition is the key to learning and
Hmm.
memorization. So, story time. Eddie, hit me with a story about anxiety.
Dude, I feel like I can just tell you like my whole experience of being a therapist. Or I can
Yeah.
just talk to like being a teenager. I don't know. Anxiety is one of those things where sometimes I wish I knew it was a thing when I was younger. Because I think there were definitely times where I would just like get this like existential dread, or I'd get like worried about something and I wouldn't know why. Like I can think of specific times where it would be like a Sunday night, and maybe it's just the Sunday scaries, but it'd be like a Sunday night. I'm in like elementary, middle school, and I just did not want to go to school next day. I'd have no
Hmm.
reason. Nothing happen. I would just, now looking back, would just get this anxious feeling of like, I just feel on edge. I feel irritable. I feel like something bad's going to happen, but I couldn't explain it. So I'd end up having to go to school anyway. So it's just one of those things that like, I wish I knew back in the day. Now I know. I see it every single day at work. A lot of our kids struggle with anxiety. A lot of teens struggle with anxiety. Adults do too. I think it's really common. I think it's one of those things that people um, will like argue or be upset about and say like, oh, everybody has anxiety. Like, oh, now everyone's anxious. And it's like, yeah, maybe everyone is anxious. We just went through a real fucked up 4 years in 2020. Like that's really messed up a lot of people. So yeah, maybe everyone is anxious. So really, I don't have a story time. I just have a reflection of life.
Yeah, and my story kind of builds on that, where I do actually have a lot of young people these days who come in on their first visits and they say, I have anxiety. I want help with my anxiety. Or parents come in and say, hey, I've got an anxious kid. Like, what can we do? What
Yeah.
are the next steps? And this shows that people are really talking about this more, that it's becoming more mainstream. Because I'm guessing 30 years ago, that wasn't a very common thing where people
Hmm.
walked into the psychiatrist already having an idea of what the diagnosis was. Um, and there are still a lot of kids these days who don't quite know how to put words to it. Or, the really young kids who, you ask them, hey, are you nervous? Are you worried about anything? Like, what makes you scared? And they're like, nothing, I'm fine. Because in the
Yeah.
moment, there's nothing really bothering them. But then you talk to the parents and they say, oh, they really worry about car rides. Oh, they really worry about going to school.
Hmm.
And, for example, I've known a lot of kids who worry a lot, who worry to the point of it getting in the way of their life, and they haven't put it together yet that it is anxiety. So I'm glad that the knowledge is increasing on this, because it needed to.
Yeah. I see a lot of TikTok and Instagram and social media therapists. I think it comes up like, it's got to be like every other week on Reddit, in the therapist subreddit, of like the self-diagnosing, or people just being more knowledgeable about mental health disorders.
Yeah.
And it's like there's both sides of it, of like, oh, everyone's over-diagnosing or self-diagnosing. But now you have people that are better informed consumers. Because when you do go into a doctor's office to see a therapist, whatever it is, you are a consumer. You're getting a service or a product. If you're a better consumer, it means you're more likely to get better help and to be able to direct the person in the right direction that is helping you. So I think that's really positive. I think it's good that more people feel comfortable sharing it, feel like they know how to describe it. I think that helps out a ton.
Yeah, and I've known some psychiatrists who don't like to engage in that conversation. Oh, that's Dr. Google talking. But I always try and talk through what my thought process is, what the DSM criteria is, if people come in with like their own diagnoses, and not just dispel that kind of stuff and say like, oh, you're not the doctor, you don't know what you're talking about. Like, I think it's important to meet people where they are and try and say why or why not if their diagnosis is what they think it is.
Yeah, it's there for a reason. They're worried about it for a reason. They looked it up for a reason. Like, if we're just going to shit on someone when they're coming to ask for help and they might be at their lowest, it's not the best thing to do.
No, yeah. We're all about openness, honesty, inclusion here at MMHC.
That's right.
We're going to give you a definition of anxiety, and this is according to the American Psychological Association. An anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure.
Mm-hmm. Anxiety is not the same as fear, but they are often used interchangeably. Anxiety is considered a future-oriented, long-acting response, broadly focused on a diffuse threat, or fear is appropriate. Let me read that again. Am I reading that okay?
Yeah.
Okay. Anxiety is considered a future-oriented, long-acting response, broadly focused on a diffuse threat, or fear is an appropriate, present-oriented, and shortly response to a clearly identified and specific threat.
Whoa. That was needlessly complicated and hard to say. You did a really good job, though. I was even reading it and like making mistakes and like, oh my gosh.
Thanks, APA.
Yeah. Very clear.
We promise the rest will be easier to understand.
So typically what I tell people is that worrying is a normal part of human life. But if you're worrying so much that it's getting in the way of you living your life, that's anxiety. And a lot of times with anxiety, I know I use this phrase a lot, but back in caveman times, there were very immediate threats, like if there was an animal that was trying to hurt you in front of you, if you're hungry and needed to get food. Now, today's world has shifted into so much future-oriented threats, like, oh, I might lose my job, I might lose my insurance, I might get more bills. And that focus on the future and worrying about the endless possibilities in the future is one of the reasons why I think just anxiety is so common in our society. Our brains weren't really wired biologically and from an evolutionary standpoint for all these constant potential threats in the future.
Yeah, too many possibilities.
Mm-hmm.
I'm going to go back to the APA definition and try to make it easier to understand. Basically, anxiety is either it's basically trying to define it in two ways. The first way is it's either future oriented, you're thinking into the future, it's like a generalized fear, a spread out concern about something. You're worried about something that's not very immediate, it's somewhere in the semi-distant future. Or it's something that's kind of right in front of you, you're worried about it, and your response and your anxiousness and your anxiety about it like makes sense. I guess the two things, let me let's talk this out in real time. The long one, like the spread out one, the general one is I'm anxious, and I'm just thinking of high school students right now because that's my population. I'm anxious about the future because if I don't do well in school right now, I'm going to go to a bad college and then I'm just going to be poor for the rest of my life because I just won't excel. That's like a longer term anxiety. A short term one is I'm going to fail this test that I have tomorrow morning and I'm worried about it. And if I do end up failing the test, then my future is ruined. I think that kind of fits what the APA is trying to say.
I like it.
Yeah. Yeah.
We have lots of different types of anxiety. Here are the major ones. There's generalized anxiety, where you just worry about everything, worry all the time. I often hear people with generalized anxiety disorder say, like, I'm worrying about my family, my friendships, safety, finances. It's just worrying about like everything in life.
Yeah. I feel like generalized anxiety is a common, I'm not saying it's overdiagnosed, but I feel it's the one that a lot of people will start with. And then eventually, as it gets teased out a little more, like in therapy or meeting with your psychiatrist, that you can get a little more specific. One thing that's a little more specific is social anxiety. So it's something that seems to be on the rise, probably related to COVID in the last 4 years. And another piece to it might be social media, just constantly feeling judged and critiqued online by other people, feeling like you have to be a certain version of yourself or else you won't be accepted by others. It's a lot of pressures that people are feeling today.
And to the best of my knowledge, I don't think anyone's ever really studied the link between social anxiety and social media. So stuff in the future that I hope gets studied, because boy, I'm curious to see what the impacts of social media are going to be on social health once we start really diving in and studying that stuff. Another really common type of anxiety is panic disorder. We're having panic attacks so bad that it prevents you from leaving the house or makes you feel like you're going to die when you have one. And then there's a little bit of a difference between panic attacks versus anxiety attacks. It's important to know that the term anxiety attack is not actually recognized as a term by the DSM-5, and panic attacks are sudden and extreme. Like with panic attacks, you have chest pain, increased heart rate, shaking, feeling disconnected from yourself or surroundings, which is like a depersonalization and derealization and shortness of breath. A lot of times people with panic attacks end up in the emergency room because they're so bad they think they are going to die.
Yeah. With anxiety attacks, it's more of a gradual buildup. So there's things like disturbed sleep, muscle tension, irritability. There is some crossover, and I think that's why a lot of people end up using the terms interchangeably. So like the increased heart rate, shortness of breath. But I do see it a lot. And I think I commend our teens for doing their best to describe what's going on. But I oftentimes they will say I'm having a panic attack when really it's probably more of an anxiety attack or an increase in anxiety, because they're not really having the chest pain, shaking, feeling disconnected from yourself or surroundings. They're more having that gradual buildup of irritability, increased heart rate, your disturbed sleep, muscle tension, like that one. So I hear it a lot, and I think it's just important to help kind of have the two definitions. They're similar, not exactly the same. So just important to remember that. We also have things like specific phobias, heights, spiders. Fucking hate spiders. The dark, that got me a lot when I was younger and probably still now. You could do the next one, just.
We talked about this on a past episode, but apparently the actor Billy Bob Thornton is afraid, like has a phobia of antique furniture. Like he was on set once with some antique furniture and he like wouldn't go. He's like, no, he had some bad experiences or something as a kid around some antique furniture and just wouldn't do it. I always like the names of specific phobias too. Like they're all Latin rooted names, like fear of heights is acrophobia, spiders, arachnophobia, and the dark is one of my favorite words of scotophobia.
Which was the one when it's, is it crowded places or just like out in public, agoraphobia?
Yeah, agoraphobia.
Yeah. That's one that I feel like doesn't match, but it's Latin, so that's why I don't fully like. Agoraphobia makes me think of something else. Yeah.
It sounds like it could be something related to like gory movies or something.
Yeah. And then another one that we see in the anxiety section is separation anxiety. So we see a lot of this with teens. I know Justin sees a lot of it in his clinic. And we just kind of makes us wonder if this is something that COVID has made worse. And I think COVID, we can just say, has made a lot of things worse. I think that's totally fine to say. It really has. It's gonna take a long time. I urge, I guess especially because I work in a school setting, but like anyone that works specifically with teens in a school setting or whatever you do, like please hang on. Like our kids are still they're building up their resilience. They're trying to get there. It's gonna take time. Even if it's been 4 years since everything started, like we're gonna need some more time before our kids kind of get back to where they were before. And that's okay.
Yeah. And I got a lot of families coming in to my office and saying like, over COVID, we were scared, but we were all in the house together because I was working from home. And then when we had to return back to school, that's where we really saw a lot of the issues at school, a lot of the separation anxiety. Kid was starting to have nightmares about losing family, separate or dropping off at school became a nightmare, and the patient was having like full-blown panic attacks. So yeah, it seems like this stuff all got worse. We're waiting on the numbers to fully roll in to see how bad things really got after the pandemic. But it definitely, from just a clinical perspective, it seems like it.
Yeah.
Some fun stats and facts, and these are according to the CDC. So anxiety disorders are the most common mental health disorders in America. And in 2019, the numbers were mild anxiety, 9.5% of Americans had mild anxiety. Moderate anxiety was 3.4%, and severe was 2.7%. So about 15% of Americans in total had something on the spectrum of mild, moderate to severe anxiety.
Something else you've seen through the research is that women are more likely to have anxiety than men. And anxiety is most common between the ages of 18 and 29. I wouldn't be surprised to see that age range extended a little bit, like maybe more like 12 or 13 to 29.
Yeah, for sure.
Yeah.
Post-pandemic, there actually was a good article that tracked some anxiety rates from pre to post-pandemic. So this is an article from PLOS ONE in 2021, Fruworth et al. And I kind of wanted Eddie to try and tackle saying that one because I always love his take on naming these scientific names.
What was the one
from
2 weeks ago?
DeWitte? Yeah. Which I think it was just DeWitt.
Shout out my dog, DeWitte.
I loved your spin on DeWitte. But Fruworth et al. Found that anxiety rates did go up from about 18% in the general population to 25.3%, and depression went up about 10% from 21.5 to 31.7.
I got to update my stats. I give a presentation in the health class that talks about, I think at the time when I made the presentation like 3 years ago, it was, I think the best I could find was stats from like 2017, 2018. It was about like 17-ish, 18% of teens get diagnosed with anxiety or depression, right around there. But obviously it's increased a lot recently.
Yeah, especially almost a third of Americans had depression after the pandemic or post-pandemic era. That's scary. That's really scary.
Yeah. Often the most comorbid mental health diagnosis that goes along with anxiety is another anxiety disorder. Depression also goes with anxiety quite frequently. I think it's about 60% of the time. So if you think about it, being anxious is just really hard on your brain. If you're constantly in a fight or flight response, it can make you feel drained and exhausted. And then being anxious also releases a lot of stress hormones, so cortisol. And prolonged cortisol exposure puts people at a high risk for depression.
And I see this all the time where kids are super anxious and they also have mild to moderate depression, or kids are super depressed and they also have mild anxiety. So they just tend to go together quite frequently.
Yeah. Even back in 2018, 2017, 2019, 2020, when I was doing more diagnosing in the clinic I worked at, it was pretty common that if I was working with somebody or I was doing their intake and they seemed to meet the criteria for depression, that there would be the specifier added on of with anxious distress. There's
Yeah,
just a lot of crossover.
ton of crossover. So
Yeah.
how can you test? I know we talked about like self-diagnosing and all this stuff. So how can you test if you really have generalized anxiety or anxiety in general? So you can always talk to a healthcare professional. You can talk to a therapist, a counselor, a psychologist, a psychiatrist. You can talk to your primary care doctor. There's also a really cool tool that I use online called the GAD-7, or Generalized Anxiety Disorder 7 questions, that gives you a specific score for your anxiety, and it can put you in a mild, moderate, severe category. And it's a very objective, very scientifically tested, accurate, precise measurement tool. So if you are really curious about like, okay, how bad is my anxiety? Look up a GAD-7 and fill it out. Usually you can find them free online.
Yeah. For children, parents can fill out a scared child assessment. I've never heard of this before. So, Justin, if you know more, please tell me.
Oh, this is the
But
part of my everyday life. Yeah.
yeah, it apparently helps to have a healthcare professional go over the results with you. And it probably also helps to have a healthcare professional tell you what it is. So, take it away.
Yeah, so it is an assessment that is used for children before they can really do it themselves, usually up to around age 12. And it actually breaks it down into multiple types. So you get like somatic symptoms, you get a score for that, you get a score for generalized, separation, social anxiety, and even school avoidance. So it's a really, really useful tool for trying to suss out what specific type of anxiety you're dealing with in young people.
Yeah. Oh, that's interesting.
Yeah.
You're probably wondering, if you haven't thought already, how do we treat anxiety? There's a ton of different ways. There's a ton of different ideas and methods, and we want to share those with you today. So from a medical standpoint, it looks like the most effective way to treat is to have a combination of medication and therapy. I don't think we've ever come on here and say only do one. So I think it's important to try to consider both and see what the best options are. But yeah, I don't think we're of the mindset of like only do this or only do that. Sometimes the combination ends up being a better fit.
And for most people, I really do recommend starting with therapy first because it's safe. There are no side effects. And if we're looking at like a mild to moderate anxiety picture, usually therapy is effective. It works, gives insight, helps you build insight into why you got anxious, what are some of your tendencies, and how to fix them and work on them so that you can fix your anxiety and not have it linger into the future.
Yeah. Well, since there is a medication component, can you tell me about it, Dr. Justin?
Yeah, so usually medicines for anxiety are very similar to the ones that we use for depression too. These are called SSRIs, or selective serotonin reuptake inhibitors. These are our first line medications, and they increase serotonin in your body and your brain. They usually take about 4 to 6 weeks to really kick in. And this is something I communicate with patients often, because in the past I had people taking it like, oh, I took it 2 or 3 times. It wasn't really helping that much. And so I stopped it. Like, oh, shoot, I should have explained it better. This isn't something that you take and the next day you think, oh my gosh, I'm so much better. It's something that you take consistently for 4 to 6 weeks. And then you look back on the last month and go, you know what? I am feeling a little bit better. I'm a little less sad. I'm not worrying as much. I'm able to live my life a little bit more. Medicines can help get the anxiety fixed faster, but I always recommend doing the therapy side of things to also figure out why you got anxious, learn some coping mechanisms to learn how to deal with it and prevent it from the future. The medicines do have a lot of side effects, and most people start medicines without any major side effects. It goes pretty well, but the most common ones is it messes with your stomach. It can cause some nausea, some vomiting, some headaches, some diarrhea. And one of the most common causes why adults in particular stop is because it actually can cause some pretty significant sexual side effects, where it can lower your libido, your sexual drive, but it can also increase or prolong your time to orgasm, which may be the first time we've mentioned that word on our show. So sometimes people start taking, the one. Sometimes people start taking SSRIs and they notice that they just cannot climax. They just cannot have an orgasm, or it just takes so long that just sex is too hard. Sometimes people like that because it makes them last a little bit longer, which can be a desired outcome too. Sometimes people will even take these medications specifically for that side effect, for premature ejaculation. But I like to tell you about the side effects just to kind of give you an idea of what to expect.
Yeah. Okay. I think I've done this before, but I want to do it again because repetition is a great way to remember something. Remember, we said that earlier. Okay. SSRIs, serotonin, selective serotonin reuptake inhibitors. I think the way this works, if I remember from biological basis of behavior in grad school, is that the serotonin that our body creates, sometimes we just don't create that much. So it kind of comes and goes and we just don't have enough. When you take an SSRI, it makes it so that when your body is like removing the serotonin from the neurotransmitters or whatever, it stops that from happening so that there is leftover serotonin so that you have more than you've previously had before. And that's the part that helps. Does that sound okay?
That was pretty dang good. Yeah, the magic area in your brain is in between your neurons. We call that the synapse. And so the medicines help to keep that serotonin in the synapse instead of getting recycled and repackaged. So serotonin, sometimes people call it like a happy hormone. It's kind of more of a balance hormone where it doesn't like make you feel happy, but it creates balance. It makes you more in the middle than too high and too low. And so one thing I always like to make a point of is that 90% of the serotonin that your body makes naturally on its own come from your intestines. So that is why your diet and the food you eat is such an important piece of maintaining your mental health too, is because your digestive tract actually makes serotonin from the food that you eat. And usually it needs fiber to make that.
Yeah. Well, okay, so we talked about medicine, but what about non-medical ways to treat anxiety?
There are 4 evidence-based, and this is coming out of, I read the book Lifestyle Psychiatry in the past. It's like 4 evidence-based lifestyle ways to improve your physical and mental health. And that is diet, exercising, sleeping well, and reducing your stress. I know those aren't like groundbreaking things like, oh my God, are you sure? But those are things that if you do make an improvement, that's more likely to improve your mental health.
Yeah. A couple things that are more on the therapy side or therapy focused, things like art and expression. Art therapy is one of those things you don't have to be great at art to be good at art therapy and to get the benefits from it. So if that's something you're interested in and you feel like you've held back because you feel like you're not a great artist, that is okay. Your art therapist is trained to help you work through it. It's not about making the next great painting and the next great drawing. Exposure therapy is another thing, really getting you to, if your anxiety is related to worry, or you're not sure how something is going to go, or you're worried about this thing happening when you go do this, the exposure of having the experience and then afterwards debriefing and seeing that you're still okay can be a lot in helping you kind of make that pathway in your brain of like, if I do this, I will be safe, I will survive, I will be okay. Meditation's also popular and can be helpful. I know for me, I suck at meditation. I can't turn my brain off, but some people are really good at it. And for some people it's really helpful. And that's great. Good for you. I am jealous. Other things that are a little more social are things like talking to your family, talking to loved ones, talking to people that are your support people. And then things like social groups, getting that experience of being around people that may also struggle with something similar to you, seeing that you're not alone in dealing with this, and seeing that there are people who live through what you deal with and are okay, and that you can be okay too.
And one last point on that is I always try and emphasize that I can give recommendations. I can give evidence-based, like I know that this works for most people, but it's okay to do it your own way too. As long as it's like a healthy thing and you're not just like railing a bunch of cocaine or something. Like If you have something that you like to do that isn't bad for you, isn't bad for anyone else, and you feel like it helps with your anxiety, it's okay. Try and do that. Prioritize it. Make it a point. Try and use it therapeutically. So much of the time, mental health treatment is just doctors and therapists like telling you what to do. But if it comes from you, it's more impactful. It's more likely to be meaningful to you.
Mm-hmm. Yeah, I like that.
We got some celebrities. So some celebs, and you look up this kind of stuff, and this is from prevention.com that I got a couple of these. And it's always kind of the same people on the list. There's your Selena Gomez's, your Lady Gaga's, but two people that I thought were really interesting. And I try and have like diversity, but I put two white guys on there because, Stephen Colbert, he had actually come out in an interview and in the past said that, especially right after he got married, that he really started having bad panic attacks and anxiety. And he actually found it really soothing to walk in circles around his couch, just over and over and over again, which sounds a little bit like obsessive compulsive disorder to me. Like you've got an anxiety, you've got something that makes you feel uncomfortable, and you have a compulsion, an action that helps you feel less anxious when you do it. So luckily he was able to work on it and get it better. But I thought that was an interesting one.
Yeah. The other white man that Justin has found is Ryan Reynolds. You've probably seen him a ton on TV. He's got Mint Mobile now. He's obviously Deadpool. He's done a bunch of other stuff, but Ryan Reynolds is one. And from prevention.com, one thing that impacted him a lot was that growing up, his father was really hard on him, and that had long-lasting impacts on him.
Yeah.
Good call. Okay, we'll edit this part. Can you hear anything on my end? Okay, good. Our fan in the shower is all squeaky now, and I can hear it, but I guess it's not making it to the microphone, so that's good. Okay, we will edit that out. Okay, discussion time. We have some questions, and the first one is for Dr. Justin. What are your thoughts on as needed or PRN and anxiety medications? PRN stands for something. I never remember it, but I know it stands for basically as needed. What are your thoughts on that?
It stands for pro re nata, more Latin.
That's right. Yep, more Latin. That's
which means as the event is birth. So essentially as needed.
Yeah.
But I personally don't like anxiety medications for as needed PRN stuff because especially in kids, like, it teaches them to just pop pills if they're feeling anxious. Oh, I'm anxious, take a pill. Oh, fix their problems with pills instead of working through it, building the skills. Sometimes they're needed. Like some kids with bad panic attacks, you need them from time to time. But unless it's like a severe case, I try and really avoid them as much as I can.
We have some kids that have, over the years, that they have PRNs, and it's like, I see that too, where it is kind of hard to, if we want to build some resiliency and coping skills, and having that as like a fallback has its pluses or minuses.
Yeah, for sure.
Yeah.
What are some
things that give you anxiety? I know we've talked about it a little bit, but what makes you anxious?
I would say for me, like feeling behind, especially like as a doctor, having a clinic, having to get people in and out, keep a schedule. Like if I feel like I'm getting behind and things really start piling up, I can start to get really overwhelmed. I can feel my heart racing a little bit. I feel like I've just got to push and go and go. And then sometimes I even like shut my brain off and stop listening to patients because I feel so like overwhelmed and out of time. Like I'm like, especially sometimes, sometimes patients can really talk and talk and talk, and that's what they're there for. But in my mind, I'm like, oh my gosh, we got to get going. I got to interrupt you, and I hate interrupting people, but I got to do it. I'm so sorry. I'm so behind. I'm so overwhelmed. So that's what I get. How about yourself? What makes you the most anxious?
Well, we've already shared that, I think. I appreciate you sharing that part, because I think it's nice to hear like real human reactions from the expert or from the doctor in charge. And I think that's super real and honest. I think for me, like not knowing, worried about how something's going to turn out, I definitely get anxious. Yeah, just waiting on results of things, or if someone mentions something and then doesn't give me all the information right then and there, I start to just, my mind races and I just like make up 1,000 different things to fill the empty space.
Yeah,
Yeah.
that makes sense.
Yeah.
How do you deal with your worry and your stress? What coping mechanisms do you have?
I think the biggest one my therapist taught me years ago was the checking the facts. So reminding
Yeah.
myself of like, if I take the emotion out of this, if I take the worry and I just look at the factual information, what does that leave me with? And I think that's been really helpful for me. And it took some practice, and I feel a lot better at it. But yeah, just trying to stop, remind myself that I'm probably just dealing with automatic negative thoughts. And I just have to look at the factual information, and that should help.
I like it.
Yeah.
I do I do a lot of deep breathing in the moment, just like really getting a whole lungful in and out. That helps me calm down. But it's
Yeah.
weird because when I talk to kids about that and young people, I ask them like, "You try deep breathing?" And most of them, like, I don't know if I've ever actually had one of them that actually say they like it and it works.
Yeah.
Which I don't know why.
Yeah.
Because I know a lot of adults who really like it and it feels like it works, but for kids, I don't know. I just haven't really ever met any kid who feels like, oh yeah, I'm really anxious. I'm going to take a deep breath.
Yeah. I think a lot of our kids have a hard time with things taking a while, or like not having
Yeah.
immediate results. So like if I'm already on edge and anxious and then having to go through the effort of like deep breathe and be mindful and do all that, like I just want something to fix it right now. I don't want to like go through that. So maybe that's what it is.
Yeah.
Yeah.
And what are the most common?
Lines,
Yes.
yeah. Some common things we hear from kids. School related for sure.
Yeah.
Relationships, family stress, and maybe like extracurricular stress or time management with the extracurriculars.
Yeah, same. Most of the time when I ask kids about what's stressing them out the most, they say school. And then it's like friends, family stuff, social groups, that kind of thing. But most of the time it's school, and it's academic testing, it's homework, it's a major stressor for kids. And I wonder if it's worse than in the past because school's changed so much, but it just seems like school is really tough on kids these days.
Yeah. It's amazing how much, especially if you're like working in like a clinic or if you're private practice, like the slow periods of the summer, how much removing a big stressor for kids just does wonders on their life and their well-being.
Oh yeah. I got summer coming up, and I'm just, if kids' anxiety is high, I say, let's wait until summer. Let's wait until finals are over. I'm not just going to crank up on that medicine right now because I think it's going to get a lot better for you.
100%. And you would hope we would take that information and be like, oh, maybe we should change something with the way schools are, but we have not. Okay. Anyway, before we dive too deep into that, we've made it to the end. Thank you all for listening. If I have any take-home point, is just to normalize feeling anxious and anxiety. Those things happen, and it's okay.
Yeah, and stress is a normal part of life. If you feel like that stress is like getting in the way of you living your life, it may be time to talk to someone about it. And a lot of people do. A lot of people feel like that stress of today's world is getting in the way of their life. It's almost like a fifth of people total. So it doesn't make you weird. It doesn't make you abnormal. It just makes you a human being.
Yeah. Well, thank you guys for listening. You know where to find us on Apple Podcasts, Spotify, and wherever else you get your podcasts. If you feel so inclined to do so, please feel free to leave us a 5-star review on Apple Podcasts and Spotify. And you can leave a comment too. We'd love to read it on Instagram, TikTok, Twitter, and YouTube at MillennialMHC. And you can visit us at our website, millennialmhc.com. Thank you all for listening. Make sure you take care of whatever anxious thoughts you're having. Make sure you check the facts. And don't forget to take care of y'all mentals.